Dr. Michael Boothby, MD of Orthopedic and Sports Medicine Institute in Fort Worth, Texas, to join us here on A to Z Sports. How are you doing, Mr. Boothby?
I'm great. I'm having a great day. Excited to talk to you guys and talk a little Cowboys football.
Indeed. I'll get right to it because one of the hot topics right now surrounding the Dallas Cowboys is their wide receiving group. And one of the players is Michael Gallup, who tore his ACL back in, I want to say, December. And then
Yes.
he got surgery in February. So I kind of have a two-part question here. There are reports out there that say he'll be 100% from his ACL injury in August, but he got the surgery in February. Two-part. Why would a player wait that long to get the surgery? And is the 7 or 8 month recovery an ideal recovery?
Sure. No, that's a great question. And ACL injury is so common nowadays in football, and we have made tremendous advances in how we treat ACL injuries and the recovery path for patients, and specifically our athletes, our high level athletes. In answering the first part, as far as the delay in surgery, oftentimes surgical intervention will take place sooner than that. And some of the things that can come up that might delay it are, lots of swelling in the knee, decreased range of motion. We really want to make sure that prior to fixing an ACL, we want to make sure that patient's motion is really back to normal and they've got good extension and good flexion. One of the risks to post-operative stiffness is actually preoperative stiffness. And so we really want to try and let the injury settle out just a little bit, decrease some of that swelling, improve the range of motion. They may have even wanted him to do a little bit of some prehab, before surgery in order to try and get that muscle strength back where it needs to be, so that hopefully he'd, have a smoother post-operative course. So there's a few reasons, why it may have been pushed out just a little bit, but oftentimes it is conducted a little bit, closer to the time of the injury, and it's really just a matter of how the knee is looking prior to surgery, how it's ranging, how it's looking, the strength, that you make those decisions.
Now, do you think he could be ready? And obviously, you didn't do the surgery or see it, but
Sure.
just general ACL injury. Could they be ready in a 7 month period?
Yeah, I mean that's a tight window. There's no question about it. I definitely think it's in the right ballpark. Typically we'll say 7 to 8 to 9 months. Adrian Peterson
Huh.
actually years ago, he kind of broke the mold in terms of seeing his recovery and the speed of his recovery after ACL surgery. And as docs, we still struggle with that today because regular patients will come in and they'll say, "Hey, Adrian Peterson did this, and I can get back to playing basketball or baseball or whatever." And the bottom line is, Adrian Peterson was a little bit of an anomaly. In fact, not even a little bit; he was a lot bit of an anomaly. And seeing somebody like that come back so quickly, though, and it being so publicized in the news, now everybody thinks they can get back in, just a few months after ACL. And the truth of the matter is, it's a 7 to 9 month process. That 7 months, things would have to go really, really perfectly. Not saying that they won't, but they would have to progress in a very stepwise manner, and not allow for many hiccups along the way, in the recovery process. He'll be pushed in terms of getting his range of motion back quickly, and then doing a lot of straight line strengthening, before they start to get into some twisting, turning, more agility work. But that 7 months, is it's doable, but it's going to be tight. There's no question.
You brought up Adrian Peterson. Everybody's not a freak like Adrian Peterson.
Exactly.
Dude is
Exactly.
it's Terminator. So
That's it,
yeah.
man. He is, and again, with the regular person out there, they don't get the same benefit of having the intense therapy, multiple hours a day, daily, that some of these professional athletes do. And so, obviously, he's going to get that sort of
Right.
treatment, and so we would expect it to be on the shorter side. But again, you can't predict the future. There may be some hiccups that come, down the road, and just a little, you got to back off just a little bit and let it heal. But we're obviously hoping the best for him and getting back out there as quickly as possible.
Now the Cowboys have a high profile running back themselves. He's not the quite Adrian Peterson in regards to physique and the
Right.
freak of nature, but he's still has been one of the top backs in the NFL in Ezekiel Elliott. And he
Sure.
informed the public that he was playing on a torn PCL, I believe partially torn PCL, for most of the second half of the season. How would that injury limit you exactly?
Sure. So PCL injuries or posterior cruciate ligament injuries are, slightly different than anterior cruciate ligament injuries or ACL injuries. The structure of the actual ligament is different. ACLs tend to be more band-like. They're more kind of like a small rope and anatomically, whereas the PCL tends to be more like a fan. It spreads out. It's got a larger attachment point around the knee, and that actually is really helpful to allow most PCL injuries, especially partial PCL injuries, to heal on their own rather than requiring surgery. So. In this case, with Zeke's injury, it's a partial PCL. He's probably going to have some soreness. He's probably going to have, some kind of deep back of the knee pain. But he really shouldn't be as limited from, a straight line or stability standpoint, especially with the bracing that they would have been offering him. Other than some discomfort and some pain, especially with explosive movements, as long as he's not having a lot of frank instability, feeling like the knee is sliding around or unstable when he pivots or twists or turns, he would be still pretty good to go there.
Yeah, I think you saw some of that explosion, that loss of explosiveness as the season kind of carried on.
Right.
The big question a lot of Cowboys fans have is would rest have been a temporary solution for him to be better later on in the season because he did not rest on it at all?
Sure, sure. It's a great question, and 2020 hindsight, you know, yes. I mean, rest typically is what we would do for the average person to give him a little bit of time to heal up, and hopefully that then translates to a shorter recovery period. In this case, though, he's got millions of dollars on his head in
Yeah.
essence trying to get out there and play football, and because there wasn't necessarily a stability issue, and because it wasn't dangerous to his knee to allow him to play. There's a factor of, hey, we're going to get out and roll with it and see how this thing does. And I think if his symptoms had substantially worsened, or if he had started to develop instability in the knee, obviously a decision would have been made to hold him out and let it heal up. But I think it was partial enough. There's grades of partial, and
Yeah.
this may have been kind of a low grade partial injury that was kind of annoying to him that it was brought up, but structurally was very sound and not unstable, and obviously not dangerous to the athlete moving forward. So I think that's why that decision was made.
Now I didn't give you this one prior, but I just want to real quick on Tony Pollard. He tore his plantar fasciitis. Did I say that
Yeah,
correct? I always get that wrong.
yeah, plantar fascia. Yeah,
Okay, he tore that, but he was able to play on it 2 weeks later.
yep.
I've seen that happen with players. What kind of pain was he having to deal with there with that?
Typically a lot. There's tearing your plantar fascia, because we put all of our weight obviously through that part of our foot. It can be pretty painful to that bottom part of your heel, and that's just with standard walking around. Now, obviously playing football with planting and twisting and turning and pushing, that's going to be exacerbated. So he would have had, uh, uh, he would have had it taped up and really trying to add some exterior support to that area while it healed. But it would have been, pretty painful. He would have been on an anti-inflammatory medicine, trying to manage that as much as possible during game time for sure. But it can be uncomfortable, and there's some tricks that we have as far as the training staff to use some different sort of inserts in the shoe to try and stiffen that some to decrease how much force goes across that plantar fascia while it heals. but it still would have been uncomfortable. There's no question. Again, it goes back to, is it dangerous for the
Mhm.
athlete? No. It's kind of one of those injuries where if you can tolerate the discomfort, you can go. But it sure would have been an effect, just again, with explosive movements.
We've got Dr. Boothby here of OSMI in Fort Worth, Texas, talking a lot of Cowboys injuries with us. And I think the biggest one, Doc, was Dak Prescott, because that one seemed to be a point in the Cowboys season where things flipped and
Sure.
the offense wasn't as explosive as it was. And the quarterback wasn't the same person that he was in the first half of the year. Now, he had the calf strain that sidelined him for a few weeks.
Sure.
How would that limit you as a quarterback?
Yeah, so calf strains are unfortunately a pretty common injury, not just in football, but across all levels of sports, both professionally, collegiately, and recreationally. And it's a muscular problem. Your calf obviously is attached to your Achilles tendon, and basically points your toes down so that we can either walk or run or sprint. It's an explosive type of problem. So when people are trying to be, to either avoid getting tackled or trying to be explosive, that's when that muscle is going to have the most force across it, and when it could risk basically microscopic tearing, which is what a strain is. Again, he would have been limited in terms of pain, in terms of that extra little burst to avoid getting tackled or a sack, something like that. But in this instance, again, it's not a structural problem like his original injury
Yeah.
was, which was a bony fracture dislocation. That's a different deal, where we're talking about the structure of the ankle and the bony parts. That part, thankfully, healed up very nicely, and he was able to be 100% on that. This is just one of those things where, again, the calf is one of those areas where it can get tight. It can actually, strain itself, and unfortunately, it's a matter of a few weeks to get him back going again.
Now you talk about his previous injury. Is that something that the calf could have been trying to overcompensate for when he broke his ankle and other ligaments? I believe it was a very serious injury.
No question, no question. He had a compound fracture dislocation, so that's severe trauma to that lower extremity, and required surgery, obviously, to fix that. And so, um, whether the calf could have been overcompensating per se, it really depends on how um, kind of accurately the patient can get back to their normal gait. If he was running with a normal gait pattern, and didn't have kind of a limp or something like that, then I think the risk is really low that his calf was necessarily overcompensating. And just calf injuries are so common. Sometimes stuff happens, and it's just happened to be the same leg. Now, to your point, if his gait pattern wasn't quite back to normal, if he did have a little bit of either a limp or a little bit of a slowdown, or was protecting it, potentially you could say, hey, that limb has had such trauma that it could potentially be a risk factor. Now, a high enough risk factor that you wouldn't play him or something like that? No, probably not. But common things are common. Obviously, he had a big injury, and if he wasn't able to get 100% back, then I think he might be at a little bit higher risk.
Wow. Hey, I appreciate this information. It saves me, Doc, from going on Google and looking up Dr. Google and then making myself freak out about these injuries, man. But
Exactly right.
this is Dr. Boothby of Orthopedic and Sports Medicine Institute in Fort Worth, Texas. I look forward to talking to you more often throughout these months here on players we may acquire or new injuries that may come up.
Sounds great. Well, I'm looking forward to it, and going to be a great off season here. Looking forward to a great fall.
Thanks, man. Appreciate you, Doc. Have a good one.
Thanks again, guys.